Welcome to this Bolder, Healthier Champions webinar on behaviour change. I am Ibrahim Sabjirali and I work for the Behavioural Science team within Public Health at Birmingham City Council. So this is a brief introduction to behaviour change, which hopefully will help you as champions, help your community or people within your workplace to lead happier and healthier lives. Now I want you to take a few minutes, perhaps pause this video if you want, and think about behaviour change and what does it mean to you. What is behaviour change? You might have had many things crossing your mind when you were thinking about behaviour change. Behaviour change is doing something which causes you to behave differently. This is the definition. It's quite simple. It is problem solving, so it helps us figure out why we do certain things. It is broad, so it can be applied to different situations. It is valuable, so we should always think about it when we're trying to improve things. Behaviour change is not a silver bullet. It's not the answer to every problem. It's not standard, so what works for one situation might not work for the other. It's not judgmental. It's not meant for us to be harmful or criticize. It's not exclusive. Anyone can change their behaviors, not just experts. Now, why is it really so important? We need to support individuals to live healthier and happier lives, and we can do this by supporting them with healthy behaviors. Now, why is this important? You've come across this, maybe perhaps or perhaps not. Healthy eating. It's recommended to eat 5 portions of a variety of fruits and veg per day. Not smoking. People who do not smoke live up to 10 years longer compared to those who do. Physical activity. Recommended to for only 150 minutes of moderate intensity activity a week, or 75 of vigorous intensity activity a week. Or limiting alcohol intake, a maximum of 14 units of alcohol a week, spread across 3 days at least. And those who engage in these behaviours have a lower risk of various conditions like heart diseases, stroke, cancers, diabetes, and other mental illnesses. So this is why behaviour change is important. Now let's bring it home. Let's talk about Birmingham. 2 in 7 year 6 children are classified as obese in Birmingham. Now, if you want to pause the video to look at the definition of obese, you can. 2 in 3 adults are overweight. Now, you have to bear in mind here and be mindful that the cause of obesity is not always linked to poor diet. There are various reasons why somebody can be overweight, so please be mindful of that when you're out in the community thinking about behaviours relating to being overweight. 1 in 10 hospital admissions is due to alcohol-related harm. So this is quite a significant number, such as alcoholic liver disease. 1 in 1,000 people under 75 dies due to cardiovascular diseases. So that's quite a lot. Quite a significant number, and diseases such as heart attack, stroke, for example. And this is why behaviour change is important for us locally. Now let's talk about the context. Let's look at the context of behaviour change. I'm going to introduce you to the COMBI model. Some of you might have come across the COMBI model, some of you not, and that's completely fine. We will have a brief introduction. There are many behaviour change models. COMBI model is one of them. It says that there are 3 interacting components to every behaviour, and these components are capability, opportunity, and motivation. C-O-M, COM, B for behaviour, COMBI, remember that. Now, what does that mean? Capability, we must feel able to do the behaviour, so we must have the ability to do the behaviour. Opportunity, we must have the chance to do the behaviour. We must have the opportunity to do the behaviour. And motivation, we must want to do the behaviour. We must be motivated to do the behaviour. So that's COMBI in a nutshell. So always keep that at the back of your mind when you're having conversations with colleagues, perhaps, or people in your community. So as you know, it really shows that they need to be interacting for us to for it to have a change an effect on behavior. We must target. So in order for us to change or maintain behaviors, it is important that we target at least one or more of those components for us to actually see change and, as I said, more importantly, maintain those changes. Now let's talk a bit more about each of those components. Comms. We start by capability, which is the C in comm. So the ability to do something, as we said, there are two types of capability. We have the psychological capability, and we have the physical capability. Now the psychological capability is the knowing what to do, is having the skills, the psychological skills to do it. For example, I know how to make a healthy meal, or I don't know how to make a healthy meal. I am confident of my cooking skills, or perhaps not, and that would affect eventually the behavior. Physical capability, am I able to do something being out of breath when jogging? For example, I want to go and jog, but because maybe I have asthma, severe asthma, I'm unable to jog, and as such, I'm not capable physically to jog. Struggling with lifting heavy pots, for example, you need to cook and you can't lift, you have problems with lifting things, perhaps. Though these are just some examples. There are so many examples that I'm sure as we're talking, you are thinking of them already. Next one, opportunity. That's combi, that's a O in the combi. As we said, we must have the chance, we must have the right set of circumstances to do the behavior. Now, what does that mean? There are two types again, physical and social. Physical, it's about having the environment, and it's about having the costs, the resources, the time to do the behavior. For example, here we've got gym. You want to go to the gym, you want to exercise. There's no gym near you, or too expensive to get a gym membership. So things like that, think of that. Nearby park, you want to go for a run, for example. You want to go to the park, but there's no park nearby, and you don't want to run on the road. It's probably not safe. Right clothes to do something. The time to do something. You want to eat healthy, you want to cook something, but you don't have the time. So think of that. Social, it's being culturally and or socially okay to do a behavior. For example, there might not be anyone to accompany the person, and they may not feel safe to do it alone, or they may not feel comfortable socially to do it. Or perhaps you go somewhere and you might feel discriminated to do a behavior. You want to go running, and maybe you don't want people to laugh at you. Things like that. Motivation, again, it's about the wanting. It's about we must want to do that behavior. We must have that motivation to do that behavior over a different behavior. There are two types again here. We've got the reflective motivation and we've got the automatic motivation. Reflective is the long term. We're thinking long term here. The automatic is the now, the in the moment. So examples of reflecting is when you're thinking about something that has happened, and you're thinking and you think, oh, I want to make a change because of that. So there's this long-term process here. For example, long-term benefits of physical activity, or you're thinking of a time when you're unable to play football with your children or your friends, rather, for example, and you believe now that if you start running, you will be able to play football with your children or your friends. So you have this, it's a long process. And if you start running, jogging, and get your body to the capacity, you increase your capacity, you'll be able to have the ability to do that behavior, to play football with your friends or with your children. The automatic motivation is the now, it's the desires, impulses, inhibition. They must think now that healthy behavior is more desirable than unhealthy behavior, and this is why you choose it. Must think, for example, running is better than not running, than sitting and watching the TV. So it's the now. So think of that at the back of your mind when you're having discussions with people. Now, some examples. These are some examples where colleagues have used various behavior change models to influence people behavior. So Public Health England, then called Public Health England, campaign for families to make simple changes to diet. In Hertfordshire, campaign to increase physical activity. Again, another Public Health England campaign to get people to walk briskly for 10 minutes daily. Again, that physical activity. And something more local here, a Wolverhampton campaign to increase physical activity. We're going to talk about active herds a bit more and break it down for you. Increasing physical activity in active herds. I thought it might be a good practical example. So you remember your COMBI model, behavior, COM. So for this capability, the two types of capability, same for opportunity, same for motivation. So for example, psychological capability, maybe they found out that people were unaware perhaps of how much exercise they need to do. Maybe they didn't have the headspace, the state of mind to do a particular behavior or to be physically active, or they just forget to exercise. Physical capability is having low stamina, having low energy, being unable to physically do the behavior, physically be active. The motivation, perhaps they needed someone to answer to. Oh, sorry, I say perhaps, but it's not, because the founders, they needed someone to answer to, or they need someone to support them in the now. Nobody to go with, for example, they want to go running, for example, or engage in do some physical activity, but there's nobody to accompany them. So, and as such, that affected their behavior, their motivation, reflective motivation. So they couldn't see the long-term benefit of physical activity, so they addressed that, or they didn't see the point. The opportunity is not being comfortable in gym clothes, perhaps, or the lack of confidence, or perhaps anxious about exercising. The physical opportunity is perhaps not enough money for the gym, as we mentioned earlier. Perhaps the unsupportive physical environment. So perhaps where they were, they couldn't exercise at home, perhaps they didn't have the right equipment, they didn't have the right place or space at home to exercise if they needed. So as you can see, we've broken down physical activity into all of these boxes, just to have a think of how this can be done. So again, there is this interaction between these three components. Now we talk about what difference can you make? So some brief interventions and give you some examples, and hopefully you'll be able to help people in your workplace. I want you to think now, as a workplace champion, think about how you can encourage behavior. Now that you have a basic understanding of behavior change and the COMBI model, think about what you can do to make this change, to help people change the behaviors, or for yourself. Perhaps if you want, you can pause the video and have a think about this. So we're going to look at two scenarios now for you to have perhaps an understanding, a more practical understanding, or perhaps come across people who fit those scenarios, and then maybe know what to do, simple thing that you can do to help them. So first, oh, sorry, before I move on to that, just answer to that question, as a workplace champion, things that you can do to encourage behavior. First thing, you can lead by example. That's the basic. Providing information if you have it, offering support, encouragement. You can help colleagues and friends develop healthy behaviors and make positive changes in their lives. So these are things that you can do. Of course, this is not an exhaustive list. There's so much more that you can do. But we'll go back to the case studies now. So we start with the first case studies about reducing alcohol intake. Let me introduce you to Stephen. Okay. Stephen is a male, 35 years old. He has a family with 2 children. He has the same manager as you, but he's also your friend. He drinks a lot of alcohol and has starting to be off sick more often. Your manager is not happy with his performance at work. Stephen wants to drink less alcohol, but doesn't seem to make any effort. Now, again, I want you to pause. Think about your own feelings and thoughts when you just read this. Personally, for me, when I read this, the feeling that I get is frustration. So if Stephen wants to stop drinking, why doesn't seem to make any effort? Again, seem is very important here. We don't know whether he is making effort or not, but it doesn't come across. It doesn't seem that he's making effort. And this is key. We go back to what we said earlier. It's not meant for us to be judgmental or criticize. We're here to help Stephen. So let's see what we can do to help him. Some of the questions that you can ask him to understand Stephen, understand his issues. Again, think about the combi. Okay. I'm going to ask a question that fits within the combi structure. So we start by capability. Again, the C-O-N, we start by the C first, the capability. So perhaps we'll ask him, what does he understand about the importance of drinking less alcohol? Or is he able to have any drink-free days, any days where he's not drinking at all? If he's not able to have that, why? Let's try to understand that. Opportunity. So what other ways to relax does he know of? Does he know any alternatives to alcoholic drinks, for example? So again, the opportunity here. In what ways would your family, would his family and friends support, help him? So find out that's how you being, a colleague and a friend, in what way perhaps your support could help him. Does he have any friends or does he have any colleague who do not drink? The opportunity, how beneficial would drinking less alcohol be to him, perhaps? That motivation. Does he think that his friends drink the same as him? More or less? If so, why? So again, engaging that conversation, understanding and trying to find more about the reasons behind him drinking, or perhaps seemingly not making an effort to stop drinking. And now I brought it back to the combi model. So again, remember, we talk about the questions you were asking about capability, opportunity, and motivation. Now, one thing is very important to bear in mind here. I don't expect you to go and sit down and have a therapy session with Stephen and write down all of this in paper and a chart and show him. This is for me to give you some examples of things that you can ask him, things that you can think of, factors to consider, things to consider. One of them perhaps supporting with one of them, just having this meaningful conversation with him, but just have that at the back of your head when you're having that conversation with him. So again, when we talk about capability here, the psychological capability, perhaps he finds it hard to say no to friends. He finds it hard to say no to colleagues after works, perhaps. Sorry, psychological capability. Physical capability, perhaps he doesn't remember an evening when he hasn't drunk. Automatic motivation, he does enjoy to have a good time and being relaxed. He does love the taste of beer. Reflective motivation, he worries about his health. He worries about the impact of drinking on his relationship, on his work. The physical opportunity, he has limited or no availability to non-alcoholic alternative drinks in places he frequents. So think about, does he need perhaps to change places that he sees, that he frequents? The social opportunity, does he does not have any friends who do not drink? So perhaps if he's out with friends, they're all drinking, so he's drinking. So think about these things that could affect people's behavior. Now, before we move on to talk about concrete actions that you can take to help Stephen, we'll take a different scenario, we'll take a different case study, and then we'll explore that. So let me introduce you to Gemma. Gemma, she's a female, 35 years old. She's single with 2 children, and she works long hours. Now, Gemma watches TV after work and eats junk food and sweets. She feeds her children the same food. She became more and more physically inactive and has developed breathing problems when going up the stairs. So that's Gemma. Now, think about what questions you can do to ask Gemma. Remember that the questions we put under each capability, opportunity, and motivation, and we'll do the same thing for Gemma. What could she do to exercise? What healthy meals does she know how to cook? What time does she have to cook, or what time does she have to exercise? What is her understanding of the benefits of healthy eating? In what ways Would her family or friends support help her? And the motivation, how beneficial would a better diet be to her? Does she know exercising can also help her relax? Again, now we're talking about this automatic motivation here, the nows, exercising versus sitting in front of the TV and eating junk food. Now we'll do the same structure we did earlier, but now we'll talk about the two behaviors. So again, capability, opportunity, and motivation, and we'll talk about better eating habits and being physically active. Psychological capability for eating is perhaps she doesn't know any recipe. Physical capability, perhaps she has never cooked before. Physical capability, again, easy to heat up frozen food. Automatic motivation, tired from work and she prefers to relax. Junk food tastes better. Reflective motivation and aware of long-term benefits. Physical opportunity, easy to buy junk food. Easy to make junk food. Social opportunity, eats junk food with children watching TV. This was for eating habit. Physically active now. Psychological capability. So you would see that some of them, there's some overlappings in some of these, but also some overlappings in what we talked about earlier at Hertfordshire, when they try to encourage physical activity, because this, people have the same barriers sometimes. She does not know easy ways to exercise. She's scared of having lack of breath. And this is the psychologically she's scared and thinking about these things, but also in terms of physically, when she does, go for a run or she's physically active, she does have breathing problem, and that stops her from being physically active. The motivation, the automatic motivation, so she's tired from work, she just prefers to relax. Reflective motivation, unaware of long-term benefits. So you can see the overlappings here. Same here, same for physical activity, same for better eating habits. Physical opportunity, no time to exercise with work or children. Sorry, no time to exercise with work and children. So she has to manage the children and work, and then she doesn't have the time to do exercise, or perhaps cook healthy meals. Social opportunity, she does not want to exercise alone, and she does not have any friends to go with her to exercise. And she's worried to be seen out of breath, for example. Let's just say there is a park near to her home, so that physical opportunity is there for her to go for a jog. But then she's scared to go and have breathing problems and perhaps her neighbors seeing her. So remember these things when you're talking to people, because it's very complex. Again, all of these interact with each other. Now that we've talked about the two case studies, we'll talk about things that you can do to change others, help others change behaviors, but also to yourself, perhaps, people in your workplace. Educate, self-monitor, and explore. First one, educate. So perhaps you can provide information or knowledge or skills to help change behaviors. Perhaps you can explain why excessive alcohol consumption, why drinking more causes health issues such as heart disease. Perhaps you can show people who wants to exercise simple exercises. Perhaps you can show them where to get simple and affordable meals. So, and if you don't know, and that's okay as well, perhaps you can signpost them to other places where they can get that information. Self-monitor. Perhaps suggest the person to monitor or record their behavior. So, for example, encourage the person to keep a food journal in a diary or their phone to track daily their food intake, to help them become more aware of their eating habits. Or you can do it yourself too, if there's a behavior that you want to change and you want to understand your own eating habits or exercising habits, for example. How many walks have you been? How many steps you track, etc., etc. Other ways you can help. Goal setting, you can prompt, you can suggest alternatives. Again, and I'll elaborate here. Goal settings, set or agree easy or small goals towards the targeted behavior. For example, encourage weekly goal of increasing number of fruit and veg per day until 5 pieces as specified in public health guidelines. We have to be realistic here. You can't change behaviors overnight. Let's just say I'm not eating any fruits or veg today. I can't automatically all of a sudden start eating 5 fruit and veg the next day and that's it. My behavior is changed and sustained. We have to be realistic. Perhaps suggest, oh, eat one tomorrow or eat one this week. Next week you can eat 2 fruits and it goes on like that. Perhaps in 6, 7, even 10 weeks, finally they do start eating 5 pieces of fruits a day where they've changed that behavior long term, had time to process that behavior, and it's more sustainable. Prompt. Put reminders to prompt a behavior. Example, place a fruit bowl on the kitchen counter as a visual reminder to eat more fruits as snacks. Or put a sticker on the bathroom mirror to remind people to brush their teeth around children, for example. Suggest alternatives. For example, suggest that the person goes for a walk rather than watching television. Again, that automatic motivation we talked earlier. So somebody's here, then now say, oh, you want to relax, now go for a walk. That might help you, better than just sitting in front of the TV. So small things like that that you can suggest. Now that we've gone, we have information about COMBI, understanding behavior change. You've seen some practical examples and ideas of how you can help. We'll give you some resources, so you can always come back to these videos and look at those resources and perhaps use them for yourself, share them for people to use them. Before as well, we go on, please remember one thing, the do's and the don't. When you are out supporting people, please remember to listen, to support, to help, to respect, to work together, and to show compassion. Don't confront, don't judge, don't generalize. More importantly, and the whole reason why you're here, perhaps watching this video, why you joined to become a workplace champion, be a friend. You want to make a difference. You want to be a friend. So most importantly, remember, you're here to be a friend and help people. So some resources now. So there's some online trainings available on the Health Education England. If you, to educate and improve behavior change literacy in workforce leaders. So if you want to do these trainings, you can scan this QR code. So for you to scan your QR code is you open your camera on your phone. If you have a smartphone, you hover the camera over this QR code, and then a link will appear. You can click on the link. It will take you to this training. Or at the bottom of this video in the description box, we put all the links. You can click on those links and I will take you to do this training. We've done that for all of them. There's some YouTube videos about if you want to know more about behavior change, COMBI model. Again, same thing. You scan it or you click on the links in the description box below. Some websites. There's the British Psychological Society website. There's the Behavioural Science and Public Health Network website, or there's the Behavior Change Techniques Taxonomy website, which are all websites packed with resources to help you in the workplace, support your colleagues, support people who report to you, support people who you report to, generally creating a better workplace environment and a healthier, happier colleagues. So we've got health and habits, again, resources. Have a look. You can scan these QR codes, or at the bottom of this video, you can click on the links. Some other websites, we've got the Better Health website, tools and apps to help, applications to help you make healthy choices relating to losing weight, quitting smoking, getting active or drinking less. Same model, you either scan this or at the bottom you can click on the link. Now some smartphone applications provided by the NHS. They use behavioral change models and they seek to change behavior, track and create healthy habits. You will need to download them on your phone if you have a smartphone through your Play Store or your App Store, type the names, or you can click on the links at the bottom in the description box again, or you can scan these QR codes. Got weight loss, cash to 5K, food scanner, active 10, drink-free days, quit smoking. So they're quite self-explanatory. Now, something more local for Birmingham residents, services provided on behalf of Birmingham City Council. To use them, the person must be a Birmingham resident and be at least 18 years old. The person may be referred to this service by their GP or other healthcare professional, or they may refer themselves. You can click on the links in the description box in the bottom or scan these QR codes. We've got weight management support for people with learning disabilities, weight management support for people with visual impairments in Birmingham, weight management support for people with physical impairment in Birmingham. Other supports for Birmingham resident, again, same model, you can scan the QR codes or click. We've got, this is designed, the Shape Up for Life, designed to help lose 5% of body weight in 12 weeks. And ensure people learn long-term habits to change their lifestyle. Weight management support program for older adults, 55 plus, free 24/7 on-demand stop smoking service. So again, as I said, scan these QR codes or click on the links at the bottom of this page. I just wanted to thank you for watching this recording, and I hope you found this helpful. If you do want to know more information, or if you want to provide some feedback, please do not hesitate to contact us at birmingham.gov.uk. Thank you.